All right. Hello and welcome everyone to today's How to Save Time and Boost Revenue in Practice Management webinar. My name is Jacob Borkover here on the webinar team at Rectangle Health, and just want to take the time to thank everyone for joining us today. We know you have very busy schedules and a lot to do, so we really appreciate you taking an hour out of your day to learn more about all things patient engagement, payments, compliance, how to operate a practice, and more. So thank you for being here today. We really have a great presentation in store for you. So before we kick things off here, just want to give a few quick housekeeping notes. We will be sharing everything in a follow-up email. You will get that within 24 hours of the presentation here. That's going to include a recording. So if anyone from your practice couldn't join, or if you have to jump off early, we'll have that for you, as well as a copy of the slides so you can review everything from the presentation. We're also going to have a few polling questions throughout. Do answer those if you can. Helps us know who we're talking to, and we're going to ask you who you are, some of the challenges you face, and different questions to make it interactive. So please fill that out if you can. If you are joining us today from a mobile device and you can get to a desktop, we do recommend that for a better experience as well. And then at the end of this, we're going to have a brief survey pop up on your screen once you close out at the end. If you can fill that out, that would be greatly appreciated. We're always trying to grow and improve our webinar content and make sure we give you guys the best presentations possible. And the only way to do that is to get your feedback. So please fill that out, very important. If you have any questions today at all, we do have someone who will be monitoring our chat. So feel free to ask questions. And if there's anything that pertains to the group, we'll try and ask them at the end as well. So if anything comes up, just do that there. And then if you have any support questions as well, you can give us an email at webinar@rectanglehealth.com, and we'll make sure to get you taken care of as soon as possible. So with that, I'm very excited to go through our agenda here. So we're going to start off, we're going to do some introductions, talk about some of the evolving patient expectations and communication trends that we're currently seeing. We're going to talk about improved ways of collecting patient payments and reducing accounts receivable. We're going to go through a little bit of compliance, talk about tips to managing your HIPAA and OSHA compliance. We're going to talk about our new Unified Practice Management Bridge platform. We're going to go through some special offers and then do a little Q&A. So excited to introduce our speakers today. So we have Kristen Hess. Kristen is a software marketing leader with expertise in commercializing technologies that resonate with customers and drive the growth of innovative brands. Her 15 years of marketing experience spans various industries, including professional services, manufacturing, nonprofits, and healthcare. She is super knowledgeable about all things payments, compliance, engagement, practice management bridge. So she'll be a great asset for us today. And then we also have Val Orozco joining us. Val has been an office manager for Rose Aesthetics in Plano, Texas for 6 years, where she oversees many different aspects of operations for the practice, works with a lot of patients on a day-to-day basis, and does a fantastic job for them. So excited to have Val with us here today. And then just a quick background on who we are at Rectangle Health. We just finished our 30th year, so we had a big 30th year anniversary. We've really been servicing thousands and thousands of practices for over 30 years. And the main thing for Rectangle Health is we listen to our patients, we listen to our clients in terms of what they see in how we can help their practice run things smoothly, whether it's patient payments, whether it's reducing their accounts receivable, whatever it may be. We've been on the forefront of making sure that we're helping our valued practices best serve their patients. So just a quick snapshot into who we are. And so we want to start off here and just kind of get to know who we're talking to. So this is our first polling question. So just tell us, what's your current role right now with your practice? Practice owner, are you a doctor, dentist, hygienist, maybe office manager, front desk, or other? All right, give everyone a few more seconds here. All right, looks like we have 85% of the votes in. So we've got 9% here are practice owners, 4% doctor, dentist, and we've got 78% who are office manager, front desk. So it looks like a majority of our people joining us are office manager, front desk. So you'll get to learn a lot from Val, who's in a similar role to you all as well. All right, and we're going to do one more polling question to start us off here as well. All right. What is your biggest challenge as it relates to managing your practice? Is it accelerating revenue cycles and reducing accounts receivable, communicating with patients and keeping a full schedule, time spent on manual data entry or administrative tasks, or adhering to compliance and cybersecurity best practices? Oh, and one more, maintaining operations due to staffing challenges as well. All right, let's let everyone get those answers in. All right, looks like we had 25% say accelerating revenue cycles and reducing accounts receivable. 3% said communicating with patients, keeping a full schedule. 23% said time spent on manual data entry or administrative. 3% said adhering to compliance and cybersecurity. And 33% said maintaining operations due to staffing challenges. So very interesting. And thank you all for participating. And with that, I'm going to send it in to Kristen. So Kristen, take it away.
Okay, thank you, Jacob, and thank you all for attending today. Something that I am personally really excited about in our conversation today, as we're all getting to know each other here, is that the majority of our attendees are customers. So because of that, my focus today is going to be on sharing what you have access to as we go through today's slides. You might have heard our big announcement about 2 weeks ago where we brought together 3 products into one platform. So whether you use one of them and you're curious about the others, or you use multiple products like Val and want to get more out of the product, I'll be talking about all 3 today. And for those of you who aren't customers, I know there were a small percentage, the overall takeaways are still applicable. So enjoy, and we're going to do our best to make this a valuable session for everyone here. So throughout the webinar, I'm going to start off with some pressing issues and challenges that we're hearing from our customers right now, and then we'll hear from Val on how they're impacting her and move on to how we're working to address it with technology. So the first challenge is what you see here on the slide, and it revolves around how patients' expectations have changed. So the same patients that we serve, each and every day at the office also access those best-in-class digital retail and consumer experiences. So think about Netflix or Amazon, and these types of products anticipate their every move, and they're really redefining expectations. So what that means is that patients nowadays expect transparency, personalization. They want things the way they want it. Convenient engagement methods and more flexible payment options. A few data points we wanted to highlight and might show those macro trends at work for you on the phone are that 85% of patients prefer text to email or phone. 72% of patients read online reviews before reaching out to a new healthcare provider, and 19% is the average no-show rate. 33% of that number don't show up because they said they didn't get a reminder. Okay, so let's move to the next slide and hear from Val. Our first question is, what recent patient communications trends have you noticed, Val? Any preferences in terms of call, text, email, or others?
So a lot of our patients love the texting service just because it's more convenient. Most of the time the patients are busy with work, busy with kids, out and about. So a phone call, it's a noisy background and it's let me call you back, to where a text is they get to text back at their convenience and to let us know, hey, they're going to miss their appointment. Let's go ahead and reschedule it. Or, hey, yes, we're going to go ahead and confirm the appointment. Or if they have any lab questions or anything like that, a simple text is always going to be easier. So we use the texting system a lot, as well as the email. That one also helps, but mainly the text message is what we use here in office.
Okay, interesting. Thank you. I'm going to go into a little more depth about how we are approaching this one with Practice Management Bridge. So on the next slide, you'll see that when it comes to patient engagement, we want to be offering patients what they expect as consumers. So that's that always on experience that feels personalized and catered to their needs. So like Val was saying, if they're out and about, a text really shows that we respect and we get what their needs are. If I could tell my health providers one thing about engagement preferences, it would probably be never to call me. So what you're talking about with trends definitely resonates with me as a person, but also I'm going to be talking more about the product today. So those of us on the webinar know that it's impossible to talk to every patient in a one-to-one way and remember everybody's needs and preferences. And so that's where the technology comes in. And we call this bridge engagement. So it starts with online scheduling and digital forms, and then it extends to appointment reminders and conveniently communicating with patients the way they prefer. Suddenly reminders and wait lists are managed, texting is a lot easier, and there's even surveys to collect reviews that demonstrate that powerful patient feedback that we all want. Focus in this area creates important benefits like reducing no-show rate, keeping your schedule full, gaining valuable patient insights, and increasing staff productivity. So there's less time spent on all the tasks I just described. I'm going to show you the product in a screenshot on the next slide. And I'm the product nerd here, so while I let you absorb this product screenshot, I'm going to assume that our current bridge engagement customers are using the product already for things like online scheduling and reminders. Definitely important, it cannot be understated, vital to revenue growth and business operations. But especially for our customers on the call today, I wanted to highlight 3 features that you might not be using that exist and you have access to already that might add more time into your day and deliver that better standard of patient engagement. So the first is called patient reactivation. You can get to that at the bottom of the screen in that teal section. And what it is it uses data from your PMS to send out recall messages to patients who are overdue for appointments and automatically notifies them to set appointments. So patients can book and request appointments using scheduling links that are delivered through text, email, and your website. And why this is really cool is that it's kind of that friendly yet automated shoulder tap. So we know that patient reactivation and recall plays a significant role in retention because it promotes ongoing care and preventative care and communication between providers and patients, which definitely leads to patient satisfaction and loyalty. But what I love about this one is that without a ton of human intervention, the process works behind the scenes to keep your patients updated and keep that calendar full for the long haul. The second one is called waitlist management. And what's cool about this tool is that it detects cancellations in your schedule and can automatically fill the vacant spots. So that definitely saves you time with coordination. We have customizable settings in there that will make sure your patients book the right type of appointment with the right provider and the right length of time. And it's great because those empty appointments are a lose-lose scenario, right? Like patients are on the waiting list longer, your practice can't bill for the time. So I love that wait list management for staying responsive and making sure our patients feel cared for. And then the last one is reputation management and patient surveys. So this feature surveys your patients following their appointments. You can kind of customize all the settings so that it automatically sends when you want it to, but it gets their feedback while the experience is still fresh. And then we instantly compile all of those responses. So turning that raw survey data into printable summary reports with graphs and charts that can also connect to third-party reviews. So it uses a net promoter score monitor that can automatically encourage them to post to a Google or a Yelp so that it's easier to get picked up online, discovered more, and it also has transparency into your practice. So we were talking about how consumers like to do research, they like to read reviews. Having something built in that keeps that going really, really helps out practices. So I love highlighting that one as well. Okay, that wraps up bridge engagement. So our next challenge for today something that, based on the survey, it sounds like a lot of you all are feeling, and it revolves around the impact of rising costs and current collection processes on cash flow. So it's expensive out there, and practices need to drive revenue in new ways and make the most of what they have right now. We have rising patient out-of-pocket expenses and compliance requirements that put significant strain on revenue streams. And then we have these outdated or different software systems that don't talk to each other, that add a lot of complexity to billing and collection processes, and that makes the problem even worse. So research tells us that 81% of providers use paper and manual processes for collections. And even if you're one of the more future-minded practices that has invested a lot in digital solutions, you're probably feeling the headaches of making all of your technology systems talk to each other and managing the complexity of all of those systems. We see patient collections being compromised by staffing gaps. We've also, we see that 4 in 10 providers have relied on external funding to remain open. And this impacts customers too. Nearly 1 in 10 patients have used a patient payment plan to pay for a recent doctor visit. So that's kind of what we're seeing in the larger market. Let's flip it over to Val and see what she's seeing. So our question for you, Val, is what strategies or tools have you implemented to reduce accounts receivable?
What we love in the office is being able to save the patient's card information on file, so that when the patients come back, they forget their card. Okay, no, we don't have to worry about it. We have it on file. We'll just go ahead and charge your card. Or the recurring payments, if you guys have any type of in-house insurance that you run, you can always do the recurring payments, and it's all linked to your software. Here in office, we have Open Dental, so everything just transfers over, so you don't have to worry about, oh my God, did I put this payment in? It's already in there once you submit it through the portal. Yeah, they are sending the text through a link. That also saves time. Most patients already have their card information saved in their phone. So when they click the link, they can easily put their card information in there and then submit it through there. And then again, it's still linked to whatever software you have to put the account in. So it just makes it a lot easier.
Interesting. That's great. I love hearing that. Those are good tips. Okay. Thank you for that. Moving into bridge payments, more specifically, we're going to talk more about what Val just covered. So this is where we're focused on growing revenue, reducing accounts receivable, and making it easy for patients to pay the way they prefer. So payments are part of running an office, of course, but how you collect them makes a big difference in reducing accounts receivable and growing overall revenue, which I think is what we really heard a lot from Val just now. So over the past 30 years, we've been really intentional about building a product that has a lot of ways to pay, so including text to pay, like she just referred to, those recurring payments, even patient financing. Yes, enhances the patient experience, but it also improves your practice's profitability because there are more options for how you collect payments, like contactless payments, think Apple Pay, online bill pay, saving the patient's card on file, and then of course doing it all in a secure way. So hopping over to payments, you can see the product here, and what I'm gonna go into a little more depth about some of the features that Val just talked about. So the first one I wanted to highlight is called Vault. Card on file, or Vault as we call it in the product, you can see it in the left navigation, is that secure and convenient way for patients to pay and for providers to ensure payment. So saving the card, vaulting the card at any phase of care within the patient journey, from initial intake forms, pre-visit to point of care, right from the card terminal to post-care, with the card on file authorization forms. We call this Vault because since cards are kept on our secure servers, everything is protected and encrypted to prevent fraud and any kind of mishandling of information. So when Val was talking about saving cards, that's where you would do it. This is important because when patients place their preferred method on file, not only is the practice being proactive in the revenue cycle management process, but it also meets the growing demands of the patient. So like we keep saying, patients are consumers, consumers are specific about how they want to pay for services. Fortunately, they're becoming more and more accustomed to storing their cards to make those future payments easier. Val, I'm kind of curious, I don't want to put you on the spot here, but if you had to estimate like what percentage of your patients are putting their card on file, what would you say?
Probably 95% of patients.
The majority, yeah. I think, yeah, it shows people are more comfortable with it. They trust it. Sounds like that's your experience too.
It just saves a lot of time on both ends. Patients don't have to worry about running back to the room to get their wallet. We have your payment on file. Don't worry, you can stay right here, and then we go ahead and just take care of it for you. So it's
one less thing to think about.
Yeah.
Okay, that's awesome. Recurring is the next one, and Val already alluded to this, but that's what we would call like our payment plan feature. So not only does it run recurring payments, but it also gives you confidence in the fact that recurring revenue is accounted for. So we'll make it easy to set up and manage those recurring payment schedules to make it really convenient for you as the practice, but also for patients, because you can easily create a payment plan. So you would put in like the amount due, the first billing date, the number of installments, and then the payments can be charged automatically with that chosen card on file. So you can see how it all kind of connects there. Why I wanted to highlight this one is because recurring payments eliminate the need for manual invoicing. And so there you're reducing the risk of missed payments. Cash flow management, of course, important for any business, and recurring payments definitely help improve that because you get that steady stream of income, the regular inflow of cash that makes it easier to maintain expenses and pay bills on time, maintain financial stability. And for the patient, payment flexibility goes a long way. So features like Vault or recurring definitely play a big role in patient retention and getting new patients. The last one for today is Balance Collect. So that's the name of the payment link that's provided to you as customers during your onboarding process. And that's what makes it possible for what Valerie was talking about with texting. So we know onboarding is a lot to take in, so I just want to remind you about this link because I know that it can be a lot to get up to speed on when you're first getting started. But it's so powerful because it helps practices get paid faster. So this link is most often used through email, text, statements. It can also be used in social media, on your website, in a QR code. And it's a great way to have more payment flexibility because the goal is to provide every avenue possible for patients to click, make a quick payment. If you are trying to find your link, it's available by email. We can always resend it to you. But why this one is really great is because customers want to pay their bills easily. They don't want headaches. And so that's usually online or from a mobile device. Data tells us that 67% of consumers prefer online payments for medical bills. And so by accepting online patient payments, you can definitely reduce paperwork and save time and increase accuracy in billing. So that is Balance Collect. Okay. Anything you want to add on payments, Val?
No, you covered it all.
Okay. We are rounding the corner. So this is our third and final challenge, and it relates to staffing shortages and high turnover rates across clinical, administrative, front desk roles in healthcare organizations. And these staffing gaps disrupt workflows and they strain resources that make it really difficult to maintain patient care when you already have so many challenges in the healthcare landscape. So it's no surprise that 82% of respondents in a recent survey noted a decline in the patient experience resulting from staff shortages. It takes about 49 days to fill a role, And then there's learning all of the technology and processes. And this one we feel across all three products. We hear customers talking about across all three. But today I'm going to look at managing compliance through the lens of this particular pain point. So when we live in a world where 95% of cyber breaches are human error, you definitely don't have to stretch far to see that correlation between staffing gap and compliance errors. It's so much to manage. It's so much to think about. There's already so much in flight. So let's hand it over to Val. All right. Tell us, what challenges do you face when it comes to managing compliance?
Okay, so it's hard to manage compliance when you have an office with a lot of staff. Making sure everyone's up to date and up to par with everything. What I enjoy the most is when when a certificate is about to expire, anything of that sort. The software does send you little reminders that such and such is about to expire. Go ahead and just get them in so they can renew it. But the ongoing and the new hire compliance, it makes it easy. You are able to basically go in and enter the information and the data, and everything is kind of self-explanatory.
Yeah.
It's not hard to go in.
So you don't feel it quite as much on the new hire side. It's more just generally managing it.
Correct.
Okay, great. Helpful to know. Yeah, and it sounds like based on the poll, this isn't something that's keeping a lot of people up at night on the call today. So I will walk you through what bridge compliance is and make sure that for current customers, you're getting the most out of the product. So bridge compliance is the product for digitally managing HIPAA and OSHA compliance. And the four main benefits of this one are ensuring that your electronically stored protected health information is safe, it's confidential, also avoiding those costly compliance gaps, reducing time-consuming processes with digital tools that make it easy to focus on exactly what you need to, and then staying up to date on the latest policies and training protocols. Of course, it's a lot to keep up with. So those would be the four main benefits of this one. As we hop into the product on the next slide, three things to highlight here. So first is HIPAA and OSHA training. So when I say HIPAA and OSHA training, what I mean is the required HIPAA and OSHA trainings that you have to do to remain in compliance. So without a digitally enabled platform that auto tracks trainings and instantly updates compliance regulations, the process can be quite manual and tedious. So this includes the trainings themselves, but also the ability to prove that they were completed. And so this one's really nice because it keeps your office compliant with HIPAA and OSHA regulations, which can really just feel like one more thing to juggle and something that can take a lot of time. The product would provide that peace of mind in knowing that your practice is compliant, safeguards your reputation and trust of your patients. So you can just focus on what you need to focus on. The second one are self-assessments, and these are self-check-ins. And when I was thinking about staff turnover, this one really came to mind because especially for a new hire, you know, this is something that you do on your own, but it would keep your practice honest on your current compliance status and uncover any areas of opportunity and strength. So if you go into the HIPAA part of the navigation, you'll find it under documents and policies. And it's just a really nice way to conduct one of those routine self-assessments and see where things sit right now. Also maintain compliance and protect revenue because it's definitely more cost-effective than risking those fines. And the final thing I wanted our customers to be aware of is the continuing education credits. So if you already pay for this product, just a reminder that you get access to continuing education at no additional cost. So you'll have comprehensive accredited courses that meet the needs of your doctors and your staff. Our library has more than 1,300 hours of continuing education and American Dental Association credits. So it's labeled Office Safe University in the product. There's also monthly CE courses that I'm sure Jacob would be happy to tell us more about. So this one's just great because it helps you stay up to date on those new technologies and codes and protocols. There's so much that goes into managing patient care. So that the idea is, to stay on top of those advancements, and depending on your role, of course, maintain your licensing. So that summarizes bridge compliance. Awesome, thank you. Okay, so we've gone through a deep dive of each of the 3 product areas. As a recap, the practice management bridge platform brings together 3 products. They're listed here on the slide: bridge engagement, bridge payments, bridge compliance. We talked about bridge engagement first. That's the patient engagement product, and it makes it possible to maintain a full schedule, to automate reminders, keep patient satisfaction high. The second one that we talked about today was bridge payments, which is the payments product. Gives you access to features like online bill pay, text to pay, recurring payment plans to make it easy for your patients to pay the way that they prefer. And then finally, bridge compliance, and that's the compliance product, which protects your practice with that stress-free, digitally managed HIPAA and OSHA compliance. So our goal with all of this is to simplify office management, to give you back time in your day. So the way that we're going about that is with one single solution, bringing it all together in one place, making sure that it's easy to implement and use, especially as users might change at your practice or changes come into play, but that's also secure and reliable. So whether you're a single office or you have hundreds, we want to make sure that it's safe and it's scalable. And then finally, it has to connect with your existing technology. This is something that Val talked about earlier, but making sure everything's integrated and talking to each other can be such a headache. And so that's something that we're really committed to making a smooth and good process for you. You definitely have enough on your plates as it is already. Okay. Jacob, we are ready to hand it back over to you.
All right, sounds good. Thank you, Kristen. There it goes. All right. So we're gonna do one more polling question here. So just want to get a quick gauge. Are you interested in learning more about any of these products? Bridge engagement, bridge compliance, bridge payments, or not at this time? All right, let's see what we got here. All right, seeing the votes trickle in here. Okay. All right, looks like overwhelmingly payments and engagement are the 2 that a lot of people selected. So that is awesome to see. 55% said payments and 37% said engagement. So really great, great to see the interest there. All right. So just want to go through really quick. So we have a lot of you joining us today are our valued clients. Thank you for being here. And we also do have a lot of people who are maybe learning about Rectangle Health for the first time. So just want to give a little bit of next steps here. So as mentioned, you will be getting a follow-up email that's going to have a little bit more information, some of the slides from today, the recording. And then in addition to that, in the next 24 hours, someone from our team is going to be reaching out to you, just kind of check in, see how things went with the webinar today. And then if you're a current Rectangle Health client, you're using any of our products, they're going to let you know about some special offers based upon the current offerings you have, whether that's adding on additional features or whether that's signing up for a new solution. Maybe you're a payments customer and you saw today that engagement is something you'd really like to have for your practice. We'll make sure that our team gets you the best offers and can kind of walk you through what that process looks like. If you're new to Rectangle Health, maybe you got our joined from ADOM or one of our other partners that are here joining today, we're going to have special first-time offers available for you as well. So when you get that follow-up call, our reps are going to be sure to walk you through all of that. And then if you're also an existing customer and maybe you want to do an additional training or take further advantage of some of the things that you're currently signed up for, you can reach out to your customer success manager and they'll make sure that they're able to fully walk you through what it is that you're looking to see more of. So, and as you can see here too, we're really fortunate to have great ratings on G2. Our clients absolutely love what we do for them and how we make things easier for them. That's really what it's all about at the end of the day. Is Rectangle Health, we're here so that we can make things easier on you. We know how busy your schedules are just from, talking to Val over the last few days. I mean, the amount of things that an office manager or front desk person does at an office is absolutely crazy. You guys are fantastic. So with everything you do, and we're here to help that. So for 30 years, we've been meeting with clients, talking to the people we work with and just seeing how and where we can make your lives easier. That's what this is all about, is trying to save time in your day and make that patient experience as strong as possible. So with that, we've had a few questions pop up throughout the presentation. If anyone has any final questions, let me just check here, or you can post them really quick. And if not, we'll let you get back with your days a few minutes early. So let me check the questions here. All right, looks like we've answered most of our questions. Kristen, are you seeing anything from your end, or I think we've answered all these?
Yeah.
All right, fantastic. Well, with that, we always like to end our webinars a few minutes early here, give people some time back in their day. So thank you again for joining us. As mentioned, a survey is going to pop up at the end of the presentation here. And we do ask that you fill that out so we can continue to improve upon our presentations here and make sure we're offering you the best content possible. You will be getting that follow-up email. So if maybe you're a practice owner and you joined the presentation, your office manager was busy, you can pass along that recording to anyone who would like. And then we do have an upcoming presentation. It's a HIPAA compliance training. It's on February 28th. It's a really great presentation. So if you're interested in signing up for that, I highly recommend you do so. Terry McDonald from our team does a great job with that presentation, and you can sign up for the link in our website. And then also, if you want to learn more about anything, any of our solutions, I do have a link to take a demo with us in the chat. So feel free to click on that. And with that, I once again want to thank Val and Kristen for joining us today. You both were fantastic. And with that, everyone have a wonderful rest of your day.
Thanks, Jacob. Thanks,
Take care,
Val.
everyone.
See you later.